My name is Shane Dawson. My age is 32.
Thanks.
It affects your muscles basically. Most your muscles don't work right. They don't retract. They don't power up, so they just kind of deteriorate. But it also affects other things. It affects your sleeping patterns. So you feel, for me, it's like I feel more tired during the day than I do at night. Although it's kind of tired all the time, really, but more during the day than at night. It also messes with my digestive tract. I get stomach aches a lot. Usually, actually, I have stomach problems 2 to 3 times a week, mostly. Like I said, in the winter, it gets worse. For some reason, during the cold, it's just worse. I have pain and stuff all the time, but in the winter it's worse than it is in the summertime. That's the other thing it causes pain a lot, and just aches, back, knees, joints, basically. I mean, it's tolerable. It's not like, you know, excruciating pain or anything, but it's like it's kind of, you get used to it. It's kind of normal for me now, but
Right.
I mean, when I was going to school in grade school and when I was younger, it was kind of irritating. Yeah, from my dad, it's not, usually it's worse when you get it from the mother, they say. Yeah, but even from the mother or father, it doesn't really matter. It's always 50-50 chance that your kids will have it. When the mother has it, it's more likely that kids will have it than the father, but yeah, it's a 50-50 chance either way. I went to a MD clinic in Georgetown, Maryland, which is a clinic for muscular dystrophy, and they, tested us. They took blood, gave us strength tests and all that, and we just walked around. And I was diagnosed, and Paul wasn't.
Wow.
Because he was stronger than I was. I mean, he was always stronger than I was.
Yeah.
Even though we were twins, if we were identical, I'm pretty sure he would have had it. But since we were fraternal, it's 2 eggs, not 1. He didn't get it, and I did. My hands, they work fine, but if I grab something tightly, it's hard to open my hand. I can barely do it myself. I have to use like my other hand to do it.
Yeah.
But if I grab something really tightly, it's hard to let go.
Right.
But also, I have problems lifting things. I have problems, some even things, I have problems grasping things. But, I'm kind of used to it. I don't really notice it as much as I used to. Plus, your tongue is a muscle, so I get tongue-tied sometimes. I have to stop talking just to rest it for a minute before I talk again.
Right, and then chewing and swallowing.
Chewing and swallowing also is sometimes a problem.
You show your wrist and stuff and talk about.
This is my wrist. I mean, when I was younger, it was normal. Now it doesn't have any muscle, so it's really skinny. And the muscle in my face has gone. So my face is long and slender. My temple is shrinking quite a bit.
Right, cool.
There is no real treatment for it. The doctor did prescribe me Dilanum, which is actually a seizure medicine, but it's supposed to help with stiffness in the hands. It didn't really work that well for me, but basically, when I feel pain, I just take a leave.
Clean out.
I just take a leave and, you know, for stomach pains and stuff like that, I just take regular stuff. You know. There's nothing really special. As I get older and this disease progresses, they should give me more like medication for pain. They should even prescribe me THC, which is degree in pot. But you know, that's not until it get worse. Right now, I'm okay. I can still walk. I can still pretty much take care of myself. But I mean, as I get older, this thing's supposed. It's a progression disease. It's supposed to get worse as you get older. So I mean, basically, they told me when I was in fourth grade that most people die from this, from congested heart failure, or the muscles in their throat don't work, so they just kind of choke on their own saliva. That was basically what they told me. They said most people don't make it to 60, but my dad, he died when he was 60. So.
Yeah.
Well, I guess, I mean, if you have a friend or somebody that has this, I mean, basically I would be patient with them and understand that they can't always go out when they want to and stuff. It's hard for me to talk. That's all I can really think of. Well, Chris asked me to go to high school, so I'd die after the first half